So my name is Ruwan Wimalasundera. I'm one of the senior obstetric consultants at UCLH, as well as a fetal medicine specialist. So that means that I look after all sorts of pregnancies, both high risk and low risk, including all the antenatal care and the delivery and the postnatal care. But as a fetal medicine specialist, I also do the scans myself. I was recruited to UCLH in 2013 to lead the twin service here and the fetal surgical service here. I particularly specialize in looking after older mums and particularly multiple pregnancies. And I helped run the multiple pregnancy service at UCLH, which is a tertiary level center where we get referrals from all over the country with high risk multiple pregnancies, because we can offer all the different types of treatment. I also offer fetal surgery here at UCLH, where we can operate on babies still in the womb, and we're the only unit in the country that's commissioned to offer in utero spina bifida surgery, so that we can help correct spina bifida whilst the babies are still in the womb, to give them a much better chance of normal development once they're born. I look after all sorts of pregnancies, both high risk and low risk, and I think my fundamental ethos is to give mothers and families the most positive experience of the pregnancy. And that includes whether they're planning for a normal delivery, a vaginal delivery, or indeed a caesarean. We just want them to have a positive experience. So each pregnancy is individual. Whether it's a complex pregnancy or a low-risk pregnancy, they're always going to be individual. And people are going to want to have their specific way of how the pregnancy should be managed. And as long as I feel that that's safe, then that's exactly how I would want to manage them. The way I like to work with my clients is that it's very much, everything is co-produced. Everything is very much based around what the mothers want, what the families want, what people go home with, what they stick with for the rest of their lives is the experience they have. Not necessarily whether it was a normal delivery or a caesarean, but whether it was a positive experience or not. But I also believe that I've got both the personal skills in terms of communication, as well as the clinical skills to be able to manage all sorts of pregnancies. I've been an obstetrician now for many years, for just over 2 decades. And so I've got an experience of looking after both high risk and low risk pregnancies. I've got the experience to detect problems early on and be able to manage them early on before they become a bigger problem. Mothers often ask, why should I go privately and why UCLH? And what I've always told them is that UCLH is one of the best hospitals in the UK. And I can know that for sure because I work for NHS England and I am the regional chief obstetrician for London. So I know how all the other hospitals work. The Fitzrovia suite has the best of both worlds. We have the benefits of having a private ward with private rooms and private midwives, but we also have the benefit of having the support of a high-risk NHS obstetric unit that can handle any emergency that can happen. And although we plan for everything to be as low risk as possible and for there not to be any emergencies, if there were, then I've got the confidence of knowing that I've got the support of other obstetricians, other midwives, and other specialist fields, such as surgery, at UCLH, which I don't necessarily have elsewhere. My philosophy around childbirth is to make the experience as personalized as possible and as positive as possible. A memory that they will keep forever, but a memory that they can smile about and be positive about. That's what I want. That's what I want for mothers, whether it's a complicated pregnancy, high-risk triplets, or a singleton that's completely uncomplicated and a normal delivery. It's the experience that mothers take home with and live with. And that's why I try to make that as personalized and as positive as possible.